You are in front of a surgery of your eyes and you've got a lot of fears, and that's normal, I can say. And I would like to give you like 5 tips which you can use in order to decrease your stress level before surgery. So first of all, there are several studies which have shown that the biggest source of our fears is actually to be confronted with something which is unknown to us. So what will help you before the surgery, at least in many of my patients, is to really try to reduce this unknown. This means like really explaining in detail the procedure, explaining in detail the expectations of the patient, but also to show them the surgical area before the surgery. So basically when you are talking, like 1 or 2 weeks before the surgery, I take my patients by hand and I go with them through the specific rooms of the surgery. Yeah, so this will be the area where you will be prepared before the surgery. This will be the waiting area. This will be the surgical theater itself. These are the devices we use. So when they see all of this, they have got a lower stress level when it is the day of the surgery, because they know all of these things. They know the rooms, they know how they look, and this way I think it gives them a lot of comfort in terms of reducing the level of unknown things, because the surgery itself is like totally unknown. So at least by knowing the room and the atmosphere, it helps them to reduce this unknown part. So this is one thing what you can do. Point number 2, what of course most patients are afraid of, is the pain level. And this I can really give you a lot of comfort, because we usually use just eye drops, and these eye drops have got an enormous effect on killing any kind of pain which you might have, because they totally numb the superficial part of the eye. And this way you won't feel basically any pain during a laser or cataract surgery procedure. And if you even get into a situation where you feel like, okay, so now it's starting to feel a little bit of burning or something similar, you can just numb the eye again. You just apply eye drops. This is not like, I don't know, I have to apply a needle or something into your body, but it's just eye drops. So if you feel a little bit of foreign sensation, you can just apply the eye drops again, and they work very fast. So basically they can help you immediately to get a relief. The point number 3 is how to deal with the fear of complications. And here I have to say, the good thing about ophthalmologic procedure is that they are performed very often. And actually, if you think about cataract surgery, for example, anyone who has reached a specific age in their life, they will get cataract surgery. So these are procedures which are really optimized because they happen so often. And with optimization, of course, the rate for complications get reduced. And this is something which you have to bear in mind, that the surgeries which you are undergoing, whether it's laser surgery or cataract surgery, are performed thousands and thousands of times. Many surgeons have got numbers above 10,000 of surgeries. So this shows you just like that they know the procedure in and out, and that it is a standardized procedure where you don't have to fear any kind of complications. Of course they can happen, but the likelihood is very little. The next thing, what is something maybe which I do specifically, but I know also some colleagues do this, I talk a lot with my patients during the surgery, and maybe you can ask your doctor if he or she is also the same way, because my patients at least report me after the surgery that this was something which helped them a lot, that I talk during the surgery with them, that I tell them like what is the next step, what will happen, whether there will be more light, less light, whether they feel a little bit of foreign body sensation or something similar, because then they are just prepared for the next step, and this will basically reduce again the unknown. So ask them whether they can talk with you during the procedure, because this helps most of people. And the last point is, of course, the post-operative period, and this depends on your expectations. Some patients have got like the expectation, okay, to see perfectly the day after surgery, and this is something which is just not realistic in many scenarios and in many situations. So you have to know that it can take a couple of days, and you don't need to panic, but it can take a couple of days till you see sharp again. So this is till you have got a clear vision again. So this is something to take into consideration. If you don't see well during the first 1, 2, 3 days, this is totally normal. It is nothing which you have to feel a fear of. It will just resolve on its own, usually within a week, and then you're good to go. I hope these 5 points will help you to have got a reduced stress level before the surgery. I can assure you as a eye surgeon that the procedures are at our age very, very safe and have got a very little risk profile. So I think with knowing all of these 5 points, what you can do to further reduce your anxiety level, I hope they will help you, and hope to see you soon again. Thanks a lot. The expertise of our team, such as risk, are very low. According to a Huh?